Hi, good morning. I'm back. Just want to give you an update on my breast cancer journey. Um, it's been a while since I gave you an update. I'm already on my fifth chemotherapy. But anyway, all my posts were late anyway. You would see that the dates look like, there's really not a whole big gap between the last time and today's post, but I didn't really get to post those videos timely, so they were actually late posts. But I've already had 5 chemotherapy sessions, um, and I just want to give you an update on what's transpired so far as my treatment and how I have been doing, how I am tolerating that. So anyway, the last recorded video, I talked about second chemotherapy. So it was day 3 after my second chemotherapy and how I was feeling. I mentioned that that was our last attempt to try the regimen that I was on. The regimen that I was on was 4 medications: Taxotere, carboplatin, Perjeta, and Herceptin. And I go in for chemotherapy once every 3 weeks. So anyway, I didn't really tolerate that. So what happened was I eventually got switched to a different regimen. So for the third, fourth, and fifth chemotherapy session, which I now do weekly, and so that's why I'm already on the fifth because I go every week now. I instead of Taxotere, I get Taxol. So Taxol, with the Taxol, I have to go in every week to get the Taxol. And then my oncologist decided to keep the 3 other medications, the carboplatin, Herceptin, and Perjeta, still in the regimen. But those 3 meds, I get them once every 3 weeks. So that's my new regimen. What happened with the old regimen was I had a lot of abdominal cramping. With the old regimen with the Taxotere, I don't have. My doctor said that if you have a history of diverticulitis, you have a high risk for intestinal perforation. I don't have a history of that, although I had been diagnosed with irritable bowel syndrome some 10 years ago, and before I was diagnosed with breast cancer, my symptoms were worsening. Like I would get abdominal cramping. Um, more frequently than when I was first diagnosed. But I never really saw a doctor to check on my condition, and so I don't really know if that's still IBS. So my oncologist, was worried about me developing intestinal perforation, and so I got switched to a different regimen, and plus I would be down for 10 days with Taxotere. I would get a lot of I would be miserable because of abdominal pain. So when I was on Taxotere, I would take peppermint all day long, do hot compress, and take a lot of Tums and Pepsid. Um, and up to the point where my doctor asked me to go to the emergency room so that they could do a CT scan of my belly. So when I went to the emergency room, a few days after my second chemotherapy session, I had the abdominal scan done. Wouldn't really see anything significant for the cramping. But also at the same time, that day, I had developed fever and low blood pressure. And they found out that my white count was low, so I was prone to infection. And so I was hospitalized for 4 days at that time. I was, they gave me a lot of fluids and antibiotic, and then I got to go home after 4 days. They called that neutropenia, and I'm not sure if the abdominal pain is related to the neutropenia. If the because of my low immune system, the because how our gut has bacteria, so or sometimes we're thinking, the my low immune system has put an imbalance in the bacteria in my gut, and so I ended up with a lot of pain. So, but anyway, the doctor didn't really mention something like that, so it's really hard for me to say. But once I was put on antibiotic, my belly pain resolved actually when I was in the hospital. Anyway, so I got out of the hospital, and then my immune system improved. So I waited for 3 weeks, and then after that, I started my new regimen. So so the regimen was taxol. So I had to get the taxol, the Herceptin, the Perjeta, and carboplatin when I went in after my hospitalization. And then weekly after that, getting taxol. Since then, things have gotten much better. I don't have the abdominal cramping anymore. I did say that from my last recorded video, I did say that I would get a lot of reflux of acid from my stomach, and I still get that. So I have been taking Pepcid regularly twice a day, and then Tamsin between. I'm not sure if that's related to my chemotherapy. My doctor has not said anything like that, or if that's something new that I now have as a chronic condition. So that's what I have been suffering from. It's been controlled, but it still bothers me, that I have that pain there in the upper area of my belly. It's not bad if I get to eat on time and I take my Tums and Pepcid, then I'm not miserable for the day, like when I was on Taxotere. As far as energy, with my new regimen, I have a lot more energy. I can be more productive every day. I get to keep up with cleaning my house. I just do like housekeeping, do my laundry, do a little bit of errand here and there. Get to go out occasionally with my husband or see some friends. So I have more energy, but I've feel that my energy is usually just good for about 4 hours, and then after that I have to, just take a nap. Um, what else can I say? Oh, the nausea. I still get the nausea. I've always had nausea, even with the old regimen, but it uh, never really went to a point where I, puked out. I would just have some burping issue, and I would take that as nausea. So I would take my Zofran or Compazine, either one, for that. And that usually um, gives me relief from the nausea or the burping. Um, I think, yeah, that's pretty much it. So I still don't have hair. Sometimes my hair, I notice with the grow back, and then, once I get my chemotherapy, after a few days, they will come off. I still have my eyebrows, haven't really lost them. Eyelashes, I don't really have a lot of eyelashes, but I lost some of them already, of course, as you can see. Um, uh, I also do get a lot of skin changes with my new regimen. I noticed some darkening on my nail bed. I don't know if you can see that. So yeah, I have some darkening on my nail bed, and also some darkening in some areas of my skin. So like here, I have this darkening here. So those are the changes that I've noticed with the taxol. Okay, so that's my update for you guys. I hope that's helpful and you learned something new today. And I will talk to you later till the next video. Thank you so much.